Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. It's on everyone's mind, it's on everyone's television, and it certainly feels like the only topic of discussion on social media, the coronavirus. Tonight, I am joined with Dr. Todd Ellerin, Chief of Infectious Disease at South Shore Health, and we are going to talk about all things COVID-19. I want to thank you tonight for joining us. I know you got a real busy schedule and you've been out straight.
Good to be here.
Yes, I want to encourage everyone at home tonight to send in your questions. This is your opportunity to write in and ask Dr. Ellerin anything that might concern you about the coronavirus, and he will try his best to answer your questions. To start, I do want to note that this segment looks a little different from some of the Facebook Lives we've done in the past. And that's because instead of doing this at the WCVB studio where we're surrounded by our colleagues and friends, we decided to bring this to you live via Skype. And that's because we really want to do our part about the whole social distancing thing. And now, just to get started on that, our first question from me to you. I know we're a little tight here. You and I are pretty close, and this might not be the most ideal for social distancing, but let's talk about that. Some people are still working at their jobs with other people. They're still at home with their families. What's the most ideal situation for social distancing, and what does that mean exactly?
Okay, so we think this virus generally spreads if you're within 3 to 6 feet of the person. So kind of close contact, it spreads by droplets, which are larger, so they tend to fall after 3 to 6 feet. So it's different from like the measles or tuberculosis, which tends to be airborne and can kind of float over larger distances. So I do think that ideally, if you can be 6 feet away apart from your kind of colleagues and friends during this time when we're talking about social distancing, that makes the most sense.
Okay. Now, let's just kind of get to the basics of COVID-19. This is very different from the flu, correct? Talk about the difference between that.
So there are similarities, there are differences. So if you want to know the differences first, they're different viruses. So one is an influenza virus, the other is a coronavirus. Coronaviruses are a family of viruses that basically cause the common cold. So literally like 1/3 of us have been infected throughout our life. Back in 2002, 2003, we met the first novel coronavirus. That was SARS. Stands for Severe Acute Respiratory Syndrome. We didn't see many cases in the United States, but we saw a lot of them in China and actually in Canada, our neighbors. That was more severe than COVID-19. The mortality rate was about 10%. There were about 8,000 cases, a little under 800 deaths. The reason I say that is because there have been hundreds of thousands of cases now described around the world with COVID-19. What that means is COVID-19 is more contagious than SARS, but it's less deadly than SARS, okay? Now, compared to the flu, the similarities are that they're both respiratory viruses. They both can spread from person to person easily. We do think there's some evidence that COVID-19 is more contagious than the seasonal flu, okay? Now, one of the questions is, how was this able to circle the globe? And the reason is because it's very contagious, so spreads from person to person. And secondly, we don't have background immunity to it. This is a novel virus. It's the first time we've seen it. So the fact is we are all vulnerable because we don't have immunity. Unlike influenza, when we tend to have some immunity, even though that immunity may decrease from season to season, which is why it's recommended we get a seasonal vaccine, we still have some background immunity, okay? But if you remember back 10 years ago, we did meet a flu that was pandemic called H1N1. That spread around the globe, and that is probably the closest thing that we have to what we're dealing with right now. That, fortunately, was less severe. This, unfortunately, looks a little bit more severe than that.
Okay, so we're starting to get some questions, and I think the first one is terrific. How worried should we honestly be? Will it get better? And that's from Will.
Okay, so Will, I think that this, first of all, we are going to get through this. There is no question, okay? I think that, but we do want to be prepared. And I think that, remember, most people, children seem to tolerate this extremely well. Most adults seem to tolerate this extremely well, meaning most people will either be asymptomatic or have mild infection. But we do want to be a little more concerned about the elderly and those with weakened immune systems, or those with chronic heart or lung disease, or diabetes, or chronic liver or kidney disease. I think that it's most important that we protect that vulnerable population. And I think some of the social distancing we're doing is to try to kind of decrease the person-to-person transmission, so we don't get all hit at once with this and then make it more contagious.
Okay. Brandon asks, do you think summer weather will slow this down?
Okay. The answer is I don't know, but I believe it is going to. The reason I say that is because many of these respiratory viruses, well, these respiratory viruses are more common in the winter. Okay. And so my gut is that as it warms up, and more importantly than just the temperature, that it's drier, this virus, this COVID-19 doesn't like a dry environment. So I think once that happens, more of us are outside, less of us inside, shoulder to shoulder, and then more of us have immunity because many of us will get infected by this virus. That combination is going to lead to a peak and then a nice decline. That will happen, and I'm hoping that it happens over the next couple of months.
That's actually a question that I had for you. We will develop, or we hope to develop, an immunity at some point, correct?
Yes. I mean, what I would say is that you don't want to get infected in the first place, but the good news is most of us who are infected will just have either mild illness or be asymptomatic and then develop immunity, which will help us in the short term. Now, what I don't know, Kristen, is will that immunity be long-lived? In other words, will it be enough for the next year? If and when COVID-19 returns, will we have immunity then? That we don't know. Also, I don't know whether this will return or not. Okay. Will this be like SARS and just die out, or will it come back? And that's a $1 million question, really.
Okay. I think you'll try your best to answer this, but you may not have an answer. Andrew wants to know, can pets get the virus? I think he's concerned about his pet dogs, cats, reptiles. Do you know anything about that?
I mean, I think that it's rare, but it's possible. I'm not an expert in this. I don't know the entire amount, but I think that it's my gut is that we are more likely probably to transmit it from person to person in the home rather than our pets. I think our pets are not a primary source of transmission for this. But again, this is a new virus. We've only known about it for a few months. So that's something I'm gonna look for, learn more about.
Okay. We have a question about, if I get sick, how long do I wait until I call my doctor?
So Joan, I think it's important that, again, to remember, the overwhelming majority of these infections are mild, and probably most people don't even have to seek medical attention for this. Okay. Now, if you have symptoms that you're more concerned about, and you feel like you really need to see your primary care provider, you need to give that person a call. It's important. You don't just want to show up in their clinic or their office. You want to call first and say, these are my symptoms. What do you think? I think I need to be seen. I think I need to be evaluated. And they will come up with a plan for you. If you have respiratory symptoms, with or without fevers, they may want you to mask. Remember, we don't want everyone just wearing masks and going outside with masks. But when you're sick and have respiratory symptoms and you have to go out in public, or have to go to a medical facility, that's when we want you to put on a mask first.
Okay, that was a question that's been coming up a lot too. I've seen in the media are folks talking about, should I just be proactive and wear a mask in my home, outside, wherever I go? There's no benefit to that, correct? If you don't have any illness or symptoms?
That's right. If you're not symptomatic with respiratory symptoms, we're not recommending that the general public wear masks.
Okay.
And this is a valuable resource for medical settings, and we're really running out of these. So I think that can't be overstated.
Okay. Carrie wants to know, is the strain changing?
Okay, good question, Carrie. What I'll say about that is we don't know yet. This virus probably mutates less than influenza viruses, and that's a good thing. So far, no signs of any dramatic mutation, but that's something we will have to keep an eye on.
Okay. We're getting a ton of questions about social distance. Why does it work?
Okay. So remember, when we didn't hear about any cases in the United States, when we first, back in December, heard about cases in China, at that point, we were hoping for containment strategies. Containment strategies means, can we keep this virus outside of the United States? So when President Trump enacted the travel ban to China, that was an example of a containment strategy. Not everyone agreed with it, but that is something that you have less people flying back and forth. You can try to keep the virus from the United States. Once we started seeing that we were having more and more cases in multiple states, then at that point we realized that the containment strategy is of less value. I'm not saying it's of zero value, because we want to keep as little COVID-19 from the United States as possible. But once it starts getting into the community, then we realize that it's going to have a life cycle of its own. And what it's doing is it's using us as a chain of transmission. At that point, social distancing is one of the major ways of what we call mitigating person-to-person transmission. So we started with containment. Some of the draconian things that China did, I think, really did slow the spread of this virus. I believe if this epidemic had started in any other country in the world, it would have become a pandemic that much faster.
Okay.
But it's in the U.S. right now, and we have to realize that social distancing is one of the major ways we can keep it from spreading from one person to another.
You know, Governor Baker spoke yesterday about the importance of social distancing and really, I think, honed in on our teens and our youth. You know, I mean, when you talk about social distancing and staying at home, this certainly doesn't mean play dates and things like that. Can you just kind of elaborate a little bit on what that message is for those younger folks who are sort of apathetic to it?
Social distancing is very important, but also it's very challenging. I mean, can you imagine with all these school closures and families that have kids at home that are just kind of cooped up in their home and looking for play dates and looking for different types of socialization? I mean, let's face it, you can only watch Frozen 2 so many times. So I mean, I think though that we do it, it is very important that because this virus is so contagious, we have to do our best. So as individuals, it's important that if we have fevers or respiratory symptoms, we stay home, we don't go to work, we don't go to school. Okay. Now that many schools are closed, what's really important is that we don't have play dates in large groups, and we have to, unfortunately, we have to make some very challenging decisions. That's easy for me to say. Don't have any play dates, don't have any sleepovers, but it's really hard to operationalize when you're trying to take care of your kids.
Is it still okay to go outside, to be in your yard, to take a bike ride around the neighborhood?
Yes.
Okay.
That is still safe.
Okay. All right. So Kathy wants to know, if you catch it, how is treatment different than the flu?
Okay. So with the flu, first of all, most people don't need special antibiotics or what we call antivirals. Okay. If you have more severe illness or if it's you want to try to lessen the duration of symptoms, you can take a medication called oseltamivir or Tamiflu. We don't have that equivalent for COVID-19 because it's so new. You can imagine we don't have any approved therapies. Now, with that said, if you are very sick with COVID-19, if you're hospitalized, if you're one of my patients that could be in the intensive care unit, then we will give you experimental therapy that has some anecdotal success, but has not been proven. And what I mean by that is we don't really know if it works or not. So for the general person with COVID-19, you're going to do fine. You have mild illness. You don't need anything else.
Okay. Ellen wants to know, if you catch the virus, how long does the illness last?
And Ellen, that really depends. It depends how serious it is. So mild illness could last a day or two. Okay. More severe illness that's in the hospital could last. When you look at the studies from Wuhan, China, hospitalized patients on average with confirmed COVID-19 were in the hospital for 12 days. Again, you could be in the intensive care unit fighting for your life. That's rare, but when it happens, you could be in the intensive care unit for months.
All right. Do existing drugs show promise against the vaccine? Are you seeing, against the virus, I'm sorry, or are you seeing anything down the pipeline?
They're currently being trialed right now, so we're waiting to see. We can't say anything definitively right now. There are a number of antivirals that are being looked at, so we will know soon. In the lab, we do know that there are a number of these that absolutely have activity. That doesn't always translate to being effective when you give it to humans. So right now, there are currently trials in humans being done around the world.
All right. We want to thank everyone at home who's sending in their questions. Really appreciate it. We're talking about the coronavirus with Dr. Todd Ellerin, Chief of Infectious Disease at South Shore Health. Thanks for writing in, everyone. Catherine wants to know, how will we know when this is over? And I'm assuming she very well could be talking about, how do you know when your symptoms are over, when you're symptom-free or virus-free, but maybe the whole thing. When
Okay,
is coronavirus going to be gone away?
So, Catherine, let me answer both. So, first
Okay.
of all, again, for the patients with mild illness, if you no longer have fevers, well, first of all, if you have a confirmed case of COVID-19, that does become a public health issue. So, what happens is we would have you isolate most people at home, some people in the hospital with more severe illness, and what would happen is you would have to get retested. And the departments of public health would help with that. They would re-swab you. And then once you were negative, perhaps a couple of times, then they would say, okay, you're symptom free. You've been tested twice. Now you can go back to, your routine of daily life. As far as when this pandemic is going to be over, remember, we have a lot of surveillance data. So you're seeing right now in the United States, we're seeing significant increases in cases, meaning if you look at the number of cases from Friday versus the number of confirmed cases from today, there's been a significant increase. Once that plateaus and then starts to decline, then we can start asking ourselves, when is this going to be over? This sounds like it's going in the right direction. So again, we also want to make sure that there's not a rebound or a second wave phenomenon. That's important, especially if our kids end up going back to school or other things. But we have surveillance, so we will know that. We'll know when it peaks, and we'll know when it starts to decline.
Okay. It may be still too early to know this, but do you know if you can catch the virus more than once?
Dano, that's a very cool name. I like that. I wish my name's Todd. It's not quite as cool, but in any event, the answer is we think that that's not likely in the short term, meaning once you get this virus, you likely will develop at least short-term immunity. That's not to say you couldn't get this again if it comes back next year, which we don't know. But once you get it, you're unlikely to get it again in the short term.
All right. I want to talk about who this affects most. You talked earlier a little bit about it, how it doesn't necessarily seem to be impacting children and adults, but it's the elderly. Why is it not affecting children? Do they have any idea?
We don't know for sure. And there's a couple of theories. I mean, what I think is most likely is that kids probably get infected by more coronaviruses than adults do, okay? And if that's the case, they may have more what we call cross antibody protection, meaning some of the antibodies that have protected them against other viruses, maybe in the same family, are protecting them against us. By the way, that is complete speculation. I don't know if that's true. We're going to learn more about that. But the bottom line is children do really, really well with this. Now, I do want just to point out that neonates, meaning in that sort of first 4 weeks of life, they can get sick with this virus. Even the neonates seem to do better than other groups. So overall, I'm really thankful that children do well. Now, one thing that I have to add, just because kids aren't necessarily getting symptoms doesn't mean that kids can't transmit the virus to adults. So that's one of the major reasons for these school closures at this time.
That was going to be my question.
Okay.
So all these school closures, there's a reason for it. We don't want children to be passing this on to adults who may be around grandma, grandpa, that sort of thing, correct?
Exactly.
Okay.
That's exactly right.
Wonderful. Ryan wants to know, what are the impacts of the virus on pregnancy? Okay,
so again, with pregnancy, we have small numbers, so you have to take what I say with a little bit of a grain of salt. But so far, good news for those pregnant women out there who are expecting to deliver during the season. It looks like the virus does the same thing in pregnancy as it does in non-pregnancy. So it's not like we have data that says that there are significant birth defects or major problems during pregnancy. Now remember, any severe infection in pregnancy could cause some problems, but overall, no difference so far between COVID-19 in pregnancy and COVID-19 in the non-pregnant person.
Okay. Elizabeth wants to know how long the virus can live on surfaces.
Wow, Elizabeth, that is really a question I wish I could answer. I know you've heard a lot. There's a lot of speculation. A lot of numbers have been thrown around, 1 day, 2 days, up to 9 days. The answer is, let me just say something. We have special tests that are super, super sensitive for detecting this virus. So when these tests detect the virus, it actually can't distinguish live virus from dead virus. So just because I tell you that I can amplify or detect virus on this countertop doesn't mean if I'm touching it, I'm necessarily going to get it and be able to infect myself. So it looks so far like it's somewhere probably between hours to days, but we don't really know what the clinical meaning of that is.
All right.
And wait, I want to say one more thing. I still think that most transmissions are not about touching the countertop. I think most transmissions has to do with being in close contact with someone who has it, is coughing on you or shaking your hand directly, then you touch your eye. But I do want to say one thing, since I just touched the countertop. I'm now going to Purell my hands, because it reminds me to say to you guys, hand washing is really, really important these days, whether it's with an alcohol gel or whether it's with soap and water.
Okay. All right. Let's talk about that. The importance of hand washing. That's a very basic thing that people can do, right? So important.
It's super important, because the soap and water really actually mechanically cleanses the virus off your hands, and the alcohol-based gels, the alcohol actually disrupts or breaks down the envelope, that outer part of this virus. And this can be the difference between getting infected and not getting infected. So let's try to be as aggressive as we can with hand washing.
And also, to clarify, store shelves have no hand sanitizer left. I mean, but basic soap and water can still do the trick, right?
No question.
Okay. All right.
And
great.
It doesn't matter if it's warm water or cold water. It doesn't matter if you use a bar of soap or whether you use a pump soap.
All right. And the amount of time that you should be doing it?
Ideally 20 seconds, minimum
Okay.
20 seconds.
Air dry, towel, thoughts?
As long as your hand's dry, it doesn't matter how you do it.
Okay. All right. Leanne wants to know, I still have to work with people, as so many people do. What can they do when they're in that environment?
Right. Like Chris and I are working together.
That's
right. So I think that, look, again, I just want to remember, with influenza, so far this season, there have been over 34 million cases. There have been 22,000 deaths just this season. And this is has been a pretty mild flu season, even though there's been a lot of flu. So what I want to remind you is that COVID-19, for the most part, causes mild illness or probably no illness. So we're desensitized to the flu. We're hypersensitized to COVID-19. So I don't want, we still have to do certain things in our life that, ideally we may be a little bit uncomfortable doing. Overall, I think if we stay home, if we're sick, if we clean our hands, if we cover our coughs, those type of basic infection control strategies, I think is going to keep us as safe as possible. Also, wiping down high-touch areas, I think that's important. But we can't go crazy and wipe down every surface that we touched before. People ask me, what about when I get my groceries and I'm about to unpack the bread? Should I clean the packaging before I take it off? For me, again, that may work for you, and if it does, that's fine. But for me, that's too much. I just want to do my best in cleaning my hands after I've unloaded all the groceries.
Well, this is going to lead to a question that I got from a colleague today that said, I'm a little nervous about getting my iced coffee at certain places. Like, should I be, wiping down my iced coffee before I take that sip? What about, transmission through food and these takeout services and so on? Any thoughts on that?
I think more important is that we keep our hands as clean as possible and we don't touch our face. That's part of it. And I realized I was in a meeting once, and I didn't know this, but someone texted me and said that I had touched my face 5 times during the hour, and I had no idea that I had done that. That's how you can get infected. So clean hands, keep your hands away from your face. Don't shake other people's hands. Unfortunately, I like to shake hands, but now is not the time to do that. I think these basic strategies are probably more important than wiping down every surface, because we'll just drive ourselves crazy. There's just so many surfaces. But I do think that periodically our iPhones, we should be wiping them down. Sure.
Okay. Getting back to questions on flattening the curve, if you will, Andrea wants to know, should businesses like hairdressers close? I mean, a lot of businesses are in limbo deciding what to do or have been ordered to close down.
Boy, I've got to be honest with you. I am really happy that I didn't have to make these decisions. These are tough decisions. It's just, I don't know. It's hard. Sometimes I feel like some of the measures are more severe than the virus itself. I'm not saying that the virus can't do severe things. And we do want to, it's true what Kristen said, it's important that we flatten the curve. But I just don't know if we end up doing more harm than good, even though what we're doing makes sense. We can say, of course, that's an example of social distancing, but how far are we going to take it? I'm just not sure.
Okay. Lots and lots of questions again about stopping the spread. Let's reiterate the fact, how do we keep the spread down without wearing masks?
Okay, so again, if we're social distancing and we're staying home when we're sick, we shouldn't need masks when we go out into public. By the way, the masks have really been shown more to help the person that's sick keep those viral particles in. So if you're coughing, that less viral particles escape and infect someone else. So I think the most important thing is good hand hygiene, keeping your distance from other people, especially if they're sick. I think those are the measures, not just going around wearing masks. By the way, if we don't wear masks right, we can also contaminate ourselves if we put it back on. So we do want to be careful of that as well.
Okay. In talking with DPH and your colleagues in the city and so on, those who have been tested positive for COVID-19, what are you hearing are those first symptoms that those patients are having?
Okay. So there are, remember something, this is so common that there are a lot of symptoms, but the most common ones are fevers and a dry cough. Fevers and dry cough. Most people are not hoarse. I say that because kids oftentimes have other viruses that can lead to hoarseness. Most people don't have conjunctivitis, red eye. Most people don't have a real runny nose. That's not to say you can't have a runny nose. You can, but that doesn't seem to be like the sniffles for 2 weeks. That doesn't sound like COVID-19. Fever, dry cough, some people have aches, some people can have a headache. So it can look flu-like. We call that sort of an influenza-like illness.
Okay, and we are getting into a period of the time of year where it's warming up and people have allergies, right? So what's the difference in knowing the difference between that and symptoms of COVID-19?
Good. So, remember, allergies shouldn't give you fevers, okay? And I will tell you that most people who've been hospitalized with COVID-19 have had fevers. It's either intermittent or it's been continuous, okay? But what's interesting is that about when you look at the cases in China that were hospitalized, less than half actually presented with fevers. So meaning they could show up without fevers and just have respiratory symptoms, but then they developed fevers. You can have nausea, vomiting, diarrhea as well, but most patients don't. So I want to be careful and not label, exactly how it presents, because it can present in a variety of manners, but most people have at some point fevers and most people have a dry cough at some point.
Okay. Caleb wants to know, how can you prevent spread if you're asymptomatic and you don't even know you have it?
Very difficult to do. That's one of the reasons for social distancing. That's also one of the reasons for these school closures, because if you think that, by the way, yes, it's true, you can transmit this without symptoms, but we don't know how often that happens, how much that contributes to transmission. My hope is that that's only a minority of the transmissions. But the best thing we can do is clean our hands, wash our hands, try to keep our distance if we can, make sure that if we're sick, we're no longer asymptomatic. So I think good hand hygiene is the best way.
Okay. Are we all going to catch this eventually? Caleb would, Sean wants to know, are we all eventually going to get this?
Okay, Sean. So this is a highly contagious virus. So I'm going to quote a Harvard epidemiologist who's studied viral transmission and viral dynamics for many years. Okay, his name is Mark with a C. Lipsitz, and what he said is his estimates were that 40 to 70% of us would be infected. Now that doesn't include children, because that part is not really clear whether they're actually getting infected or they're not, and that also doesn't take into account all of these mitigation strategies. So closing the universities, school closures, closing these these events that have a lot of people. So I think it's unclear. I do think that many of us will be infected by this virus.
Okay. George asks a really great question. Is it possible that this virus has been around long before we even knew about it?
Well, I think that it probably hasn't. And the reason I would say that is because if it had been around, I would expect more of us to develop some immunity. And our immune system is strong and actually basically can give us, it's almost like footprints, meaning it can, if it sees the virus again, it can come back up and protect us. The fact that this has become a pandemic by definition makes us think that we really don't have immunity to it. So this exact virus, my guess is, hasn't been around before.
Okay. Marie, if you have symptoms, should you take any medication? Does Advil help or anything like that? Or
Well, there is some studies that have shown that Advil or these what we call non-steroidal anti-inflammatories may worsen things. So that is not, again, that is speculative. Okay. But what I would say right now is if you were choosing between Tylenol and an ibuprofen, for now, I would probably go with Tylenol. But I wouldn't be surprised if that publication really is questioned. So I think the answer is the jury's still out on that. But of course, hydration is very important. When we're sick, we want to make sure we have enough fluid. And by the way, if you have a low-grade fever, or even if you have a high fever, if you feel okay, you don't have to take something to get the fever down. The fever is a normal response. But if you have a severe headache and you're feeling just terrible, then of course, we want you to take something. I would stick with Tylenol for now. That may change.
Okay, so now we're getting into some questions about testing. Paul wants to know if he has no symptoms, why or when would he get the test? So right now there's, right?
That's right.
Clarify.
That's right, Kristen. So if you don't have symptoms right now, you don't want to get tested. No symptoms, no testing. I know there may be occasional high-profile figures that have been tested when they're asymptomatic, but we're recommending against that. And I called the Department of Public Health in Massachusetts about that. Currently, if you're asymptomatic, no testing.
Okay, so just outline very quickly for us who will get that test.
So that's a good question. And it's not an easy question to answer because we don't have unlimited tests. If we had unlimited tests, the answer would be different. But right now, I think it's most important to test people who have more severe illness, those that need to be hospitalized or in our intensive care units, and also staff, obviously healthcare providers who have symptoms. We have to make sure that we're not infecting our patients. So it's important to test those. As far as patients in the outpatient setting, I think if you have milder illness, that you can just go home, hydrate like we talked about. If you have fevers and don't feel well, you can take a Tylenol, and you want to keep your distance from others. And in many ways, we're probably going to treat it more like a flu-like illness. As far as when you can go back into the public. But right now, I think most testing, because we have somewhat of a shortage of testing kits, by the way, we're better than we've been before, and things are looking better. But at the same time, we're trying to keep pace with the fact that more and more of us are getting sick with flu-like illness. So for right now, I would limit testing to the sicker patients who may need hospitalization, or healthcare workers. All
right. Joe wants to know, federal authorities have warned that this could potentially last until summer. What's your gut feeling on that?
That is possible. It is absolutely possible that we could see cases into the summer. That may be, but I'm really hoping that the peak occurs as the weather warms, and so we're going to start to see a decline. But I can't sit here and say, this is going to be over before July 4th. That's impossible. We could. Now, I want to remind you, SARS lasted 7 months. And remember something, SARS was much less contagious than COVID-19. It was more deadly. COVID-19 is not nearly as deadly as SARS, which is the most important thing. But COVID-19 is more contagious. So there could very well be cases going into summer.
Okay, I have one last question. How long after you get exposed do you develop symptoms? Lindsay, I know we've talked about this a few times, but if you could just reiterate.
Yeah, okay, Lindsay. So on average, the incubation period is around 5 or 6 days. Okay, it can be less, it can be 1 day, and we think that it probably can be up to 14 days on the long end. But most people who present, it's probably somewhere in that 5 or 6 day range, which is longer than the flu, by the way. The flu is usually a day or two.
Right. Okay. Final thoughts tonight. I mean, the key takeaway message, any top tips that you can give folks at home about this?
Okay, so the first thing I want to do is let's take a deep breath. because we are going to get through it. It's scary right now because we're so sensitized. We're seeing measures in social and financial disruption that we've never seen before. Okay, but I do know that we will get through this. We're taking this seriously. The state is taking this seriously. The country is taking this seriously. I think common sense measures. If you're sick, stay home. Okay, if you're sick, try to keep your distance from people in your family. I know that's not easy. If you are on home quarantine or home isolation, you have to take that seriously. All right, those good hand washing, very important. If you're coughing, use your arm. If you're sneezing, use your arm. I think those kind of basic principles are going to help, keep us as safe as possible. Some of these other mitigation strategies, it definitely will flatten the curve. I just hope that it doesn't do more harm than good. And we'll see when we do the retrospective after the season is over.
Dynamite. Thank you so much
Thanks.
for joining us tonight.
Thank you, guys.
Terrific. We really enjoyed having you here to answer these questions. We want to thank everyone back home who sent in their questions tonight. We had some terrific ones. If you missed tonight's segment, you can log on to onehealthyboston.com to review this all again. We want to say thank you to our folks back at Channel 5. Thanks so much for carrying us. Facebook Live, Skype. We will catch you soon. Have a good night, everyone.
Good night.